In recent years, artificial intelligence has begun to occupy an increasingly prominent role in medicine and clinical psychology. Today, I want to address a key question, especially relevant for parents and professionals. Can artificial intelligence currently help or help in the future in the treatment of autism, ADHD, and other neurodevelopmental disorders? And more importantly, what does the actual scientific evidence say? When we talk about artificial intelligence in healthcare, we are not talking about replacing the therapist or the doctor. We are talking about computational systems capable of analyzing large volumes of data, identifying patterns, and supporting clinical decision making. In neurodevelopment, this includes machine learning algorithms, digital therapies, social robotics, and language models applied to education and behavioral support. In the case of ADHD, one of the most frequently cited advances is the development of prescribed digital therapies, such as Endeavor RX, a therapeutic video game that received authorization from the Food and Drug Administration. This treatment is based on research led by neuroscientists like Adam Gazzaley, who study attentional plasticity and cognitive training. Clinical studies show modest but significant improvements in objective measures of sustained attention. This does not represent a cure, but rather an evidence based complementary intervention integrated within a supervised clinical framework. In autism, one of the most researched areas is social robotics. Robots such as Casper or Now have been used in controlled studies to train basic social skills: turn taking, joint attention, emotional recognition, and functional communication. Research published in peer reviewed journals, including feasibility RCTs, suggests that these robots can facilitate learning in highly structured contexts, especially in children with high social avoidance. However, systematic reviews agree that sample sizes remain small and that these systems should be considered auxiliary tools, not substitutes for human intervention. One of the most promising contributions of artificial intelligence is the personalization of treatment. Various authors have proposed precision medicine frameworks applied to autism, where algorithms analyze behavioral, cognitive, and therapeutic response profiles to adjust interventions more efficiently. This could reduce the traditional trial and error approach that characterizes many current interventions and move toward more individualized plans. Another rapidly growing area is early detection assisted by AI. Recent studies, including publications in JAMA Network Open, have shown that machine learning models can identify patterns associated with autism in large pediatric databases. Other works explore video analysis and early behavior. It is essential to clarify that these systems do not diagnose, but they can speed up clinical referral, which is critical for initiating early intervention. Language models like ChatGPT have generated enormous interest. Recent studies in Kumir and Nature have evaluated how these systems respond to questions posed by people with autism and how they handle tasks related to theory of mind. The results show potential for education, structuring routines, and psychoeducational support, but they also reveal a significant risk. These models can generate incorrect answers with high confidence. Therefore, its clinical use must be supervised and ethically regulated. From a clinical perspective, there are three major risks. First, the privacy of children's data. Second, algorithmic biases resulting from unrepresentative data. And third, the temptation to use AI as a substitute for professional care. The literature agrees that artificial intelligence should be integrated as clinical support, never as a replacement for the therapeutic relationship. In conclusion, artificial intelligence does not cure autism or ADHD, but when it is integrated ethically, based on evidence, and with professional supervision, it can improve detection, personalize treatment, and provide support to families and therapists. The future is not artificial intelligence instead of humans, but artificial intelligence working alongside trained professionals. If you're interested in us analyzing specific applications, ethical risks, or how to integrate AI with ABA and schools, let me know in the comments.